Hello, my name is Dr. Nancy Messonnier. I'm the director of CDC's National Center for Immunization and Respiratory Diseases, and I lead CDC's COVID-19 vaccine efforts. In less than a year, multiple COVID-19 vaccines have been developed, put through clinical trials where they were tested for safety and efficacy, manufactured, authorized, distributed, and administered. I believe we're truly on our way to ending this pandemic with the widespread use of these vaccines. We anticipated having a few bumps in the road as the COVID-19 vaccination program has been rolled out. However, public health experts have extensive experience with vaccine distribution and administration and are working to quickly overcome any obstacles. CDC is working with existing U.S. state, local, tribal, and territorial health departments to coordinate the distribution and administration of COVID-19 vaccines. Daily doses administered continues to rise, with more and more doses administered per day. We're continuously working with states to understand roadblocks and figure out how to overcome challenges in vaccine administration. It's important to remember that vaccine supply is still limited, and we encourage people to be patient until supply increases. Right after COVID-19 vaccines were authorized by FDA, CDC's Independent Advisory Committee on Immunization Practices, known as ACIP, identified groups to receive the initial doses. This ensures people at highest risk from COVID-19 and essential workers are vaccinated, in addition to being equitable and fair with a precious commodity. I want to reinforce that while ACIP and CDC make national vaccine recommendations, we expect that there will be local adaptation and that there will be overlap between vaccination phases from state to state. Many states and even communities are in different phases of vaccine administration. Right now, many states have expanded groups recommended to get vaccine, including opening up vaccination to people 65 and older and frontline essential workers like teachers, first responders, and grocery store employees. This maximizes getting vaccine into arms while also being mindful of people who are at higher risk for complications from COVID-19 because of age or because they are more likely to be exposed to the virus because of their jobs. As we move forward, I want to emphasize two things are on my mind when I think about COVID-19 vaccines: safety and equity. While the current vaccines and the ones we hope to have soon are rigorously studied during clinical trials, there is a vast network of safety systems that keep monitoring vaccines once they're being used. Like with other vaccines, including the flu vaccine and the shingles vaccine, some people might have short-term side effects like pain and swelling at the injection site, or a fever or headache afterwards. But those typically go away in a day or two. These vaccines are safe and effective, but that won't matter if people are not willing to take them. It's essential that people have confidence in the vaccination program, including having trust in the vaccine, the vaccinator, and the system that produced it. CDC is working with communities nationwide to build trust in the midst of a pandemic, especially in communities of color that have been disproportionately affected by COVID-19 and have experienced systemic racism and inequity in access to health care. Vaccine is being distributed in a fair and equitable manner, but we understand if you still have questions or concerns. That's okay. That's expected. Your healthcare provider and local health department are good resources for your questions, as well as the community leaders you trust every day. Vaccination is a critical tool in bringing this unprecedented pandemic to an end. Thank you.